Hello, everybody, and welcome to your final group session. I am so excited for everybody here because today you guys will finally be getting your surgery date. How I always start this out is I want you to know where this bariatric Bible is, or also known as the Bariatric Surgery Success Guide. And I always call it the Bible because it's really any question that you guys have, or really anything, you can find it in this packet. So it's the Bariatric Surgery Success Guide. I hope everybody here has already read it through at least once, but how do you find this? Go to our website first. Once you get to the website, hover over for patients, and then actually the bariatric surgery is right here. It's the third thing down, and you click it. Now, when you click it, it will download. So that's why I always recommend that you download this to your iPads, Androids. You can have it literally on your phone at the tip of your fingers. And I promise you, you will have questions. It is a lot of information. So please make sure that you do this and you actually read it through 2 or 3 at different times. While it's loading, I do want to say congratulations. I know you guys are probably super nervous, but super excited. It's a very interesting way to feel during this time, but that's why this is really my favorite because you guys finally get your dates and it becomes real. It becomes a reality, and wow, this is actually happening. So if you need us, we are here for you. Like I said, you guys are a part of the Lane family, so please let me know if you need anything. If you need me to call you or anything like that, I am here for you. All right, so in this bariatric surgery success guide, you can actually click on and it will jump you to that portion of the success guide. So a lot of people, like once you actually have already had surgery, you can skip to like the diets and things like that. So you would press here. All right, so the first thing that we're going to talk about is actually your multivitamin. So, no matter if you have a sleep or a bypass, you will be needing to take one multivitamin a day and then 3 calcium citrates a day. So, how do you take this? So, when you wake up in the morning, I do want you to take that first serving of your bariatric multivitamin. Now, this bariatric multivitamin needs to contain 3 things. The first thing is thiamine, vitamin B1. The second thing is 400 micrograms of folic acid. And the third thing is greater than or equal to 18 milligrams of iron. Now, once you take this in the morning, then you have to wait 2 hours and then you take your first dose of calcium citrate with vitamin D. And the reason why we have to wait at least 2 hours is because you need your body to time to take up all of those vitamins. So that's why it's super important to wait the 2 hours. It doesn't have to be exactly every 2 hours, but just at least 2 hours. Now, you basically repeat this 2 other times. So I want you again to take that calcium citrate 3 times a day. Now, I also recommend taking at least your multivitamin with food so you don't get nauseous. Now, you can also take non-bariatric multivitamins like Flintstone Complete, Nature Made, but unfortunately, you will have to take 2 servings of this. And a lot of times, like I know that Nature Made and some Centrum, they have actually 2 tablets per serving. So in some of these cases, you would be taking 4 of these a day for your multivitamin. So please, I do recommend actually getting the bariatric multivitamin that we show you because, again, that is only 1 tablet a day for that multivitamin. Now, why is it so important to take your vitamins? So this is a lifelong aspect of both a bariatric surgery. And like I said earlier, the sleeve and the gastric bypass and revisions, whatever you have, you should be taking vitamins for the rest of your life. And why is this? Because the surgery has decreased your dietary intake, decreased dietary choices, and decrease your nutrient absorption. And all 3 of these things come together as a potential for nutrient deficiencies. Now, like I said earlier, we do recommend these 2 bariatric multivitamins. The first one is going to be the Celebrate 145, and the second one is going to be the Ultra Solo with iron. Okay. Now, whichever one that you choose, I then recommend that you then get the sample pack so you can try the different kinds of calcium citrates. Now, a lot of times patients tell us, yes, it's great. It tastes like my Starbucks for the day. So, sorry, not starburst for the day because it kind of looks like a starburst. But the calcium citrate in them makes them taste very weird. So I always recommend that you actually taste it to make sure that you actually like it because I actually hate anything that tastes like caramel and I actually like these caramel ones. So definitely recommend that you try the different kinds out and then you get the calcium citrate for a couple of months so you have it on hand. So just some tips for adherence, pair it with another habit. So I know that I wake up every morning and I take my multivitamin. It's right there when I walk up in my kitchen. So do what works for you. You can use timers, alarms, and apps. Verytastic is an amazing app. You can also set it to remind you every 10 minutes to sip that clear liquid when you get out of surgery. You can use pills, containers, whatever you need. Please use it because this is a very important part of your journey. Now, what is your preoperative timeline going to look like? So you are in your final group session. After this, you will meet with me on your one-on-one. Well, we will get your surgery date. After this, Leslie will reach out to you. We will talk to you all about the payments and things like that and get that situated. Now, as soon as you get off the one-on-one with me today, please make sure that you get your preoperative medical clearance. Now, there is some patients on this call that actually do not need to get a preoperative medical clearance. They will only need to get labs. And these patients are the patients that are going to be done at the surgical institute, okay? At the surgery center. If you are at the surgery center, all you need to get is labs, and we will send you those labs to complete. You do not need to complete the preoperative medical clearance. Now, if you are going to a hospital, you will need to get this done, and this needs to be done within 30 days. So as soon as you get off the phone or get off the one-on-one with me today, please make sure that you call your primary care doctor and make sure that you can get that appointment within that 30 days. Also, I want you to start your preoperative diet as soon as possible. So you will hear me say this multiple times today. I want you every day to have 4 pillars, the 4 pillars goals, okay? So these 4 pillars, I want you to have 70 to 100 grams of protein a day. I want you to drink 64 ounces of fluid a day. I want you to have less than 50 grams of net carbohydrates a day. And the fourth one is less than 15 grams of added sugar a day. And you will hear me say this a couple of times throughout this talk, but I am not a proponent of calorie counting. I need you just to reach those 4 pillars every single day. And if you can do that as soon as you start, so when you get to surgery, you're not kind of shell shocked that your whole diet is kind of changing after surgery. So it does help you to kind of get acclimated to it before surgery. Now, 2 days before surgery, you will have to have a clear liquid diet, which we will go over in a little bit. Now, your preoperative diet, again, I want you to hit those 4 pillars. And every time that I look at your plate, I want your plate to look like this. Half of your plate needs to be protein, a third of your plate needs to be veggies, and a sixth of your plate needs to be fiber. Okay, so fiber includes fruits and beans. And then 64 ounces of liquid, so some clear liquids. Now, like I said, this will help you carry forward your learning habits from surgery. And also, it actually shrinks your liver too. So you want to help out your surgeon. The smaller that your liver is, the easier my job is, and you want it to be easy. So your stomach is actually underneath your liver. So the larger it is, the more issues that I have. So you'll also help me out as well. This is a whole list of your preoperative diet now that it can contain. This is not an all-encompassing list. And remember, I want this list to always, when you are eating, especially fruits, to be less than 50 grams of net carbs a day. Okay. For example, a banana, one entire banana has 24 grams of net carbohydrates in it. So that takes up almost half of those net carbs. Please make sure that you are adding the fruits into your net carbs every single day as well. Like I said, we want to eliminate all of the high carb foods, all of the starches. Having starches significantly increases your glucose level and then spikes your insulin level. The surgery itself actually helps that. So we don't want to work against your surgery. So that's why for at least 6 months, I do recommend no starches. So that's bagels, bread, cake, cereal, things like that. Please make sure do not have any starches. Now, I know Dr. Dovek says 6 months, but I actually recommend doing this until you hit your goal weight. Once you're at your goal weight, you can slowly start increasing this, and we will explain to you how to do that after surgery as well. Now, remember, sugary drinks have a lot of added sugar in it. I want you to have less than 15 grams of added sugar. So that's a lot less than all of this stuff that it has. So please make sure to cut out that regular Coke, chocolate milk, regular Gatorade, orange juice. This is a PSA. Um, uh, when you juice, so like orange juice or things like that, it actually takes the good part of the fruit, takes it out, and you only drink the bad part of the fruit. And there isn't really any good and bad part of the fruit. But for example, 1 cup of orange juice has about 6 oranges in it. So that's 6 sugars of an orange that you have in 1 glass. So I do not recommend juicing. It is not the best for you. It significantly increases your glucose levels as well. So please make sure to stay away from that. Alcohol. We also recommend to stay away from alcohol 1 year after your surgery. That's also very important. Now, how do you calculate your net carbs? How do you calculate your protein? And how do you calculate your added sugar? And I will tell you all of this on this nutrition fact label. So the first thing that we're going to go over is net carbs. So you look under the total carbohydrates, that's 22 grams. You subtract the dietary fiber, which is 13 grams, and then subtract the sugar alcohols, which are 5 grams. So in total, the net carbs is 4 grams a day, okay? Now, how do you calculate your added sugar? So in here, it actually here underneath carbohydrates also says includes 0 grams of added sugar. So I want this number to equal less than 1515, okay? And then also protein. So in 1 Quest bar, you have 21 grams of protein. I want this number to add up during the day to 70 to 100 grams, okay? So 3 out of those 4 pillars are on this nutrition fact label. You will become best friends with this nutrition fact label, and over time you'll get to like memorize certain things so you won't actually have to use it every single day. We are okay with sugar substitutes. If you have a sweet tooth, I am okay with you using this to make some healthier desserts, not with any added sugar. Now, 2 days before surgery, you will have to be on a sugar-free clear liquid diet. So for example, let's say that your surgery is on Wednesday, this will start on Monday. If your surgery is on Friday, this will start on Wednesday. And if your surgery is on Monday, this will start on Saturday. So 2 days sugar-free clear liquid diet. I promise you that when I go into your abdomen, I will know if you did this or not because my job gets harder if you don't do this. Your bowels actually, if you eat normal food, are very non-pliable. It takes, they're very stiff to move. When you have a sugar-free clear liquid diet, they move very easily and they're very pliable, easy for me to kind of touch them and manipulate them. So please make sure to do this sugar-free clear liquid diet. Also, it shrinks your liver significantly. So again, makes my job easier. Please see all the stuff that's listed here. I'm going to point out some things to you. The first thing, wonton soup. Love it. It's the best thing in this list that actually has some taste to it. Just make sure to drain out all the wontons and you're just eating the broth. You can have herbal decaffeinated tea, water, Gatorade Zero, Powerade Zero. The most important thing that I want you guys to get is this protein water. Protein water counts not only for clear liquids, but also that protein. So it counts for 2 things in your 4 pillars. And the reason why I say for everyone to get this is because it kind of helps you with the hunger, especially those 2 days prior to surgery. And also after surgery, it helps as well, because I promise you, you're not going to be hungry after surgery. So this will also help you, increase your protein and also your clear liquids at the same time after surgery. So this is just some schematics of everything that you can have. Please make sure that you are avoiding the alcohol, caffeine, all of this stuff. And your liquid should be see-through, and you need to be drinking every 30 minutes to stay well hydrated. Please remember the day of surgery at midnight, nothing by mouth. So the midnight before surgery, please make sure that you are not eating or drinking anything except for the medications that I will tell you to take before surgery. Now, what medications do I give you for surgery? So I send this to the pharmacy, the closest pharmacy to wherever you're having surgery, and you will get sent this pharmacy location in an email. So I send you 3 medications. The first medication is the only medication that you will be taking every day, no matter what, for 3 months. This medication, the Protonix, decreases your acid production in your stomach and helps everything heal. The second and the third medication are the as-needed medications. The second medication is for nausea. This is called Zofran or ondansetron. You put it underneath your tongue and let it dissolve. If you don't let it dissolve, it does not work. So please make sure that you are letting it dissolve. Other things for nausea that help very well is mint herbal tea, so peppermint, spearmint, anything like that. And also ginger tea helps a lot as well. So please make sure that you have those teas on hand to help with the nausea. Lastly, the pain. You will have chest pain, shoulder pain, and back pain, and that's completely normal. That is from the gas that we blow up in your abdomen. I promise when you wake up, you are not having a heart attack. So the narcotic pain medication we actually give to you, only 5 tablets, and it's an oxycodone tablet. I tell you guys to always take it before you go to bed that first night. But we only give you 5. That is it. Florida is very strict, so we can only give you 5 tablets. Now, you're going to be like, wow, Dr. Lane, that's it? That's all we get for pain? No, there is a couple of things that I want you to get over the counter. The first thing is going to be the Tylenol Extra Strength. I want you to take 2 tablets every 6 hours, no matter what, for 3 days. That's going to help that soreness in your belly. You will feel like you did 1,000 sit-ups in 2 or 3 days after surgery, and this will help you stay on top of that pain instead of trying to catch up to that pain. Lastly, the gas X. Remember, I told you you're going to wake up and have that chest pain, shoulder pain, back pain, completely normal. That's from the gas. Other than walking, walking is going to be your best friend. That is what actually helps the most with the gas pains. This can also help as well. You can take as much gas X as you like. You cannot overdose on it. So you can take 4 or 5 of them a day. As gassy as you feel, you can take it. So don't worry about that. Now, other things for pain as well that I tell everybody that they can also get is lidocaine patches over the counter. You can also get icy hot over the counter. Just make sure you're not putting those over your incisions. And you can also get heating pads help as well. Now, while you're getting ready for your surgery, I also recommend that you buy your papaya enzyme. This medication you will not need until you're on that soft food phase on your weeks 3 and 4. So when you use this is when you're eating something that's solid and you kind of forget that you even had surgery because you feel so good, and it gets stuck right here. And so if you take this papaya enzyme, it increases your salivary secretions and helps push the food down. So that's why I always recommend that when you're buying everything, just go ahead and buy this to have on hand as well. Please remember that smoking is horrifically bad for anybody having bariatric surgery. It Smoking itself is bad, but when you add bariatric surgery on top of it, it's like I don't know, atomic bomb of worsening of the symptoms. So please make sure that if you have stopped smoking, congratulations, but please continue to stop smoking after bariatric surgery. Now, what do you have to bring the day of surgery? You need to bring a support person that's over 18 that can drive you home. Because remember, everybody here will be going home the same day of surgery. You will also need to bring your insurance card, your ID card, and if you are on a CPAP machine, you will also have to bring that CPAP machine. On the day of surgery, you will arrive at the time that we give you. That arrival time will not be given to you until the business day before surgery. And that's because it's an OR and times change at the last minute all the time. So that's why we give it to you. The hospital or the surgery center will call you to tell you the exact time to arrive for your surgery. Okay. Now, you will get brought back to the preoperative area where you will meet the nurses, the anesthesia team, and finally, you will meet me where we will take that amazing picture that everybody hates the day of surgery, but will end up loving in a couple of months because you will see the difference. It's that before and after, okay? Then we bring you back to the operating room where you will actually get the sleep or the bypass. The sleep takes me about 30 minutes. The bypass takes me about an hour. And then finally, you will be taken back to the post-operative area where you will have to do 3 things: walking, peeing, sipping, and then you get to go home, okay? Now, just to go over your surgeries, the first thing that we do is the sleep gastrectomy. We take your stomach from the size of a football down to the size of a banana. And then secondly, the gastric bypass. We take you from the size of a football down to the size of a thumb and then completely rearrange your small bowel and skip 277 centimeters of your small bowel, where at this Y portion, you start digesting normally. Now, this is a whole list of everything that we've kind of already gone through, so just make sure you're watching this. Let's start talking about that post-operative diet. Everybody wants to know this, right? So, week one, so that starts the day that you come home from the hospital, you will be on a full liquid diet. Please make sure that you have a lot of protein shakes available because I promise you, you will be taking in a lot of protein shakes, especially at the beginning, because that's really what's going to increase your protein to get you to reach that 70 to 100 grams a day. Like I said, you will be on that full liquid diet. There's a bunch of other options like the bariatric pal soup. You can use the Too Good smoothies. Just make sure, again, this is all zero sugar because if you don't get this, that's not zero sugar. There's a lot of added sugar in certain yogurts. Week two, you will be on a pureed or minced food diet. So please make sure that you're taking bean-sized bites. You will also need to make sure that you're stopping to drink prior to eating and then you don't drink 30 minutes after eating. Please make sure that the food is smoother ground in texture and it's moister than anything. We do have a couple of recipes that we have here. Some other recipes that I find that are really good is the ricotta cheese bake and also the healthy buffalo chicken dip is also a really good one as well. The soft texture diet. So this will be weeks 3 and 4. You just need to make sure that all of your food is essentially fork tender. Please make sure to avoid any dry cuts of meat. And please make sure to use sauces as well. I want all of the food during this time to be very moist because I promise you it will get stuck. Okay. Again, please make sure that you're not drinking while eating and you're waiting 30 minutes afterwards. And then lastly, your regular texture diet. So all of the rules are the same. You're going to be having dime-sized pieces every single time that you bite. You need to chew thoroughly to a puree consistency and swallow. Please make sure that you are not eating any raw veggies, hard fruits, and tough cuts of meat until 6 to 8 weeks afterwards because I promise it won't feel good. And really, this is the exact same diet that I want you to be on pre-op, so you are completely used to this diet by the time that you get back to it. Remember that plate, half of that plate being protein, a third of that plate being veggies, and a sixth of that plate to be fiber. Now, we're going to go over your medication in our one-on-one today on the Hilo Patient Portal app. But a few things that I want to go over. You can continue to take pills. You don't have to change any of your pills. There are some of the medications that are very important that you take the morning of surgery. So please make sure that you follow up with me very closely and you listen to my directions because sometimes if you either take something or don't take something, anesthesia may cancel your surgery. Okay. NSAIDs. Please make sure that you're holding any type of NSAID, Aleve, ibuprofen, Motrin, Excedrin, for at least 2 weeks prior to your surgery. However, you can safely take them occasionally after surgery. If you need to take them more than occasionally, please just let us know and I do have to prescribe you another medication, but you will be able to take them. Please make sure to hold any of your estrogen-containing birth control for 2 weeks prior to surgery and continue holding them 4 weeks after surgery. I will go over this with you in our one-on-one. Another thing that I have to talk about, okay? If you are of childbearing age, which means that you have not reached menopause, you will be at a higher risk of getting pregnant. I don't care if you've had the worst infertility, you have never had a period in the last 5 years. I don't care. I promise you that you will get very fertile after surgery. This has been a problem that we've kind of been having recently where patients have been getting pregnant within a month after surgery. That is not healthy for you or the baby. We do recommend that you hold off on pregnancy for at least 12 to 18 months, okay? I know that some of you may be having this surgery to get your to help your infertility, and I know that time is of the essence. So that's why we say we can push it to 12 months, but really the safest time would be to hold for 18 months. We will talk about every other medication on the planet when me and you talk on our one-on-one. Thank God we are almost out of cold and flu season, but you are able, if you have the cold or flu, you are able to take whatever you need. Just make sure that there is no NSAIDs in it. Unfortunately, constipation is an issue after surgery. So I want you to have a bowel movement within 3 days after surgery. If it's on that third day and you have not had any bowel movement, please make sure to take one time only enema that day, a Fleet enema. It's over the counter at CVS, Walgreens, whatever pharmacy. And then afterwards, I want you to take 2 Colace a day and a Miralax until your bowel movements are more regular. This is a whole list of constipation tips that you can use to help you with constipation. But again, remember, I want you to have a bowel movement within 3 days after surgery. So if you get to that third day and you need help, you can always reach out to us and we can tell you what to do as well. This is what those incisions will look like. They are covered with glue. So because they are covered with glue, it is okay if you go wherever you want. Hot tub, pool, lake, wherever you want to go, you can go. You can take a shower the same day after surgery. Again, just make sure that they are still covered with glue. Return to work. Let's say that you work from home. Then I always recommend taking at least 3 days off, the first day after surgery and 2 days after. If you work in an office, but you don't have like a very strenuous job, I recommend taking off a week. And if you have more of a strenuous job, teacher, construction worker, or you work in a hospital, so you're up and walking all day, we do offer you to take off about a month, only a month, 4 weeks, and we can fill out those FMLA paperwork again for you. Just to let you know, we only allow 4 weeks, so that is it. But please reach out to us if you would like a work note as well. Movement. Movement is so important. So I know that I have also talked to you in our initial group session that bariatric surgery is a tool, right? There's so many things that go into weight loss. And actually, working out is part of that. I want you to be active, and it's not really working out. I just want you to be active. So please make sure that you are doing at least 150 to 300 minutes of moderate intensity exercise a week. Now, I'm not telling you to go out the day of surgery and go, run a mile. What I'm saying is that I want you to work up to that. So I know that a lot of you may be, not active at all. And I would be happy if you started with, I don't know, 10 minutes of walking a day. So please make sure to just reach that goal. And we also want you to have 2 or more days per week of muscle strengthening activities as well. So, what's going to happen after surgery? Again, we want to make sure that you're walking, peeing, sipping. You get to go home after the day of discharge. You will get a call from from the operative facility, and you will get a text from us here at Body by Bariatrics. Then you will also have an initial follow-up with Amber, our advanced nurse practitioner, and I'm sorry, our PA. And then at 6 months, you will also have a visit with her. And then at 1 year, you will have a visit, an annual visit as well. At that 6 months and 1 year, you will be doing labs to make sure that that all of your lab values, your vitamins are all good to go as well. We do have a scale available. It's a great scale, the Withings Body 2 Pro scale. This has metabolic tracking with muscle mass, bone mass, hydration, so much more. If you are interested in this, we do have it as a discounted price of $149.99. It is only sold in medical facilities, so we wanted to make it available to you as well. Now, like I kind of hit on earlier, bariatric surgery is a very small part of this whole process. So please make sure that you're getting adequate sleep, balanced nutrition. Hannah is there for you, our dietitian, at any time that you need her before surgery or after surgery. We also have a behavior therapist with Project Reset. That's absolutely amazing. She is a bariatric specialist to help you on this journey as well, because this is not easy. So many people say that it's the easy way out. This is not easy. And she is there to help you as well. And then finally, regular exercise. And this is, we call it the pieces of success or the pillars. I like the pillars. If you have not printed out anything from this entire packet, I want you to print this out and put it on your refrigerator, because this is going to be your goal every single day. So say it with me one more time. 64 ounces of fluid, less than 50 grams of net carbs, 70 to 100 grams of protein, and less than 15 grams of added sugar. Please don't forget, every third Tuesday of the month at 7 p.m., we do have a support group. So our next one is actually going to be May 20th. If you need anything, you know that we love texting, so we are available through text messages. But if it is after hours and it's like just after surgery and you have an urgent or emergent question, please make sure to call the office at 407-707-5018. And if it is after 5 p.m. or on a weekend, we do have a messaging service. So you will be speaking to a human to make sure that they get to either myself or Dr. Dobek. All right, so I know I went through a lot, but I cannot wait to see you in our one-on-one today, and answer any questions that you have. Let's get you your surgery date. We'll talk to you later. Bye.